Governor Ned Lamont of Connecticut, thank you for coming on the People's Cabinet.
Nice to see you, Dan.
So there's a lot of fighting, discord, and not a lot getting done in D.C. You're busy there managing, is it a $55 billion budget? Do I have that number correct?
That's right, over 2 years.
Yeah. So that's a big responsibility. And unlike in D.C., where there's a lot of saber rattling, hyperbole, and grandstanding, you actually have to get things done every day. And I think there's a lot that people hear at the national level of what the downstream effects of DC's policies are on states and on people. But I don't think, candidly, there's been a good enough explanation as to how this actually does affect people every day. And so I'm hoping, given the work that you do every day, you could help elucidate some of that for us. And there's a few topics that I want to cover, but I want to start with Medicaid because there's a lot of conversation at the national level, a lot from Trump and some Republicans talking about how it's just waste, fraud, and abuse, and that we're not actually taking people off healthcare, but we're actually just making it more efficient. I know you disagree with that, so I'd love for you to talk a little bit about Connecticut and how it is affecting your state and the concerns that you have.
Pretty tough to put together a budget. Medicaid is $11 billion out of our budget. Say we've got $30 billion, including the federal piece every year. And when they talk willy-nilly about, hey, we're going to get rid of waste, fraud, and abuse, God bless you, go for it. What you could do there at the federal level, but they're not doing that. DOJ didn't do that at all. All they did was push Medicaid costs onto us, hold back money, threaten to hold back money, makes it really difficult to budget. It scares the heck out of a lot of my residents. Look, I have, 50% of my kids in Connecticut are born under Medicaid. That Medicaid pays for them. What happens? 40% of my folks in nursing homes are paid for by Medicaid. So it's pretty easy for DOJ to say, we'll cut 10%. The states will figure out how to do it. That's not the way it works at all. We want to work with people when it comes to waste, fraud, and abuse. That's not what they're doing. All they're doing is cost shifting.
And can you talk about how it typically works how the state typically works with the federal government in normal time to make sure that you're getting the proper funding for Medicaid? And then also, if you've had any kind of indication from DC about how these cuts will work and who will be affected and what new paperwork might exist or anything like that.
Well, it changes by the hour. You see what companies are going through when tariffs are on, tariffs are off. We have the same thing when it comes to SNAP benefits and Medicaid and a lot of other programs that are just incredibly helter-skelter as they come through. Generally speaking, we know we're getting paid about 50-50 on Medicaid, and some things we get a 90-10 share for things on Access Health, otherwise known as Obamacare. A lot of that is being jeopardized. Probably the subsidies for those folks on the exchange, that could go away on January 1st, 2026. We're doing an analysis, Dan, in terms of who's impacted, how they'll be impacted, what alternatives do we have for them. I don't think it's any way that the states, and this is true on both sides, can make up for all the shortfall and sudden changes coming out of Washington. We're going to do our very best to take care of the most vulnerable.
And can you do a hypothetical, and I know you're still doing the analysis, of what a person who is currently on Medicaid does now and what he or she may face as a result of these changes?
So let's say the average person on Medicaid in the state of Connecticut, I'd say 70% of them are working. And those in the other 30%, maybe they're working part-time, maybe they're taking care of somebody with severe disabilities in their home. And you're right, a lot of the rules we see coming out of HHS would, give you some opportunity for them to continue. But the paperwork burden in order for them to demonstrate and prove that on a, bi-monthly basis is incredibly burdensome. And I think DOJ and HHS, the feds, are hoping a lot of these guys will just give up on health insurance. And don't think for a second that saves anybody any money, because if they're not getting health insurance via, say, Medicaid, then they go into uncompensated care, and then the hospitals come to the state again and say, we have a lot more people who are not able to pay their health care due to insurance. Will you make up the difference with taxpayer dollars? It's a fraud.
Can you also talk about how that affects SNAP as well and how you're thinking about that? I think people hear the SNAP acronym, they hear food stamps, they don't quite understand how it typically works. So can you talk about how it works in Connecticut and the analysis that you're doing right now as a result of Big Beautiful Bill and the implications in DC?
Yes, SNAP benefits food support for those who are food insecure or at risk of going hungry. We usually had 4 or 5 pallets of fresh food come up from the feds, every month. All of a sudden, that was cut off. That's not waste, fraud, and abuse. That was food that would go to our food bank, and we distribute that, via pantries and the such to those most in need. That's been cut off. The SNAP benefits, the band formerly known as food stamps, there you would get that allocated to you on a monthly basis. We did some smart stuff. We doubled the amount of SNAP benefits you got if you got Connecticut grown fresh produce. So we're steering people towards the healthiest food and also ways that we could support our farmers. That all is going to be shut down by the end of this year.
When you talk to people on the ground, what are they saying to you about this? Do they feel the effects yet, the uncertainty, and what stories have struck with you as you have a conversation with your constituents?
Uncertainty and fears, it hasn't hit yet. And it could change 4 times between now and the end of the year. But that doesn't help people's anxiety, which is, particularly anxious for people, especially load that in with the Hispanics and folks with an immigration background being scared of going out on the street right now, scared of going to a health center, scared of going to school. Double that with the food anxiety and the healthcare anxiety. The state provides some Medicaid support for young undocumented up to the age of 16, I think, at this point. We're going to see what we do with that, given how the response is from the federal government. We can work through federally qualified health centers or other way we can make sure people get support, but it's just an anxious period for people right now, and it's really unnecessary.
I feel like there's so much ideological hyperbole in DC about the issues that you're talking about, which candidly, it's easier for someone in DC to do that because they don't have to actually execute like you do. One area that you alluded to that I'd love for you to opine more about on is the area of Medicaid and undocumented immigrants, because there are some who say, oh, we shouldn't provide any health care to undocumented people. But you also alluded to the fact that hospitals will take on these costs regardless and ultimately roll back to the state. How do you think about that? And how should an average voter think about that in reality?
So we work with our local hospitals. We had free healthcare day. We went to local school, for example. We had thousands of folks coming through, many of Hispanic background, probably more than a few of them undocumented. Give you everything from immunizations, checkup, ophthalmology, chest. Then they say, who wants to sign up right here with your local health center? And we'll get you a primary care doc, somebody you can count upon going forward. You know what? Nobody wanted to sign up. Nobody, especially with Hispanic background, wanted to have their name on a list. They were just too worried about what that would mean. And you're right. If you throw these people off of insurance, people aren't dying in the street. You're still going to be taken care of by a hospital, but somebody is paying for that. And it's even worse if people wait until they're really sick. They don't have a choice. They go in the emergency room. That drives up costs and also creates an awful lot of unnecessary sickness and worse.
Another area that obviously is in the news a lot of conversation is on tariffs. You have a business background. You know what it's like to run a business and try to manage costs. But also, it's not just larger businesses. It's small businesses trying to manage a very small margin to begin with. What are you hearing about the implications of Trump's tariffs on the small businesses in Connecticut? And as you mentioned, the uncertainty that a lot of people are feeling that one day it's going to be at this deadline. Trump just announced again that he's extending some 90 days, that kind of thing.
Dan, you've got some business background as well. I mean, one thing we all want, I think that's true of small families and small business alike, is some certainty. And that's where you make investments based upon some prediction about what the future might bring. This tariff policy has been so helter-skelter, herky-jerky, on again, off again. And to think for a second that people are going to make long-term investments based upon another 90-day pause or 90-day acceleration of some tariff policy is just insane right now. I think the markets would feel a lot better if people just stabilize things a little bit, give us some sense of continuity and sense of what we can bet on for the years to come. And secondly, tariff rate, that's just a 6-letter word for tax. I can't stand everybody celebrating, hey, we got a 15% tariff. Look what we've done to the European Union. That's 15% that over time you're going to be paying. You're going to be paying that for everything from food, the pharmaceuticals. You're going to see that reflected in inflation. I think it's a very short-sighted policy.
Is there a business or business owner story that comes to mind as you're hearing and
Yeah.
talking to people in
One
the
of our
community?
biggest employers is called Stanley Black and Decker. They make tools, maybe tools
Sure.
you used to. And right now, they import a fair amount of stuff. They're paying tariffs on that. They've taken about an $800 million hit to their bottom line. So some of your followers may be saying, that's great. They're not passing on all that cost to me. Yep, the company is eating that difference. It's billions of dollars for General Motors, by the way. But they're not going to be able to do that for long. And I think you're going to see those costs passed along. Wait till you see the cost of a tape measure in a year. That's a Stanley Black and Decker tape measure.
How are you then managing your budget in the context of this? Again, I think a lot of listeners don't quite, or oftentimes in the news are not being educated, so to speak, about the realities of governing in this environment. Right? It is sexy and sometimes exciting to see the drama that unfolds in DC, but it is anything but for you that actually has to make the numbers work, and you have to balance your budget. You can't run deficits, right? So how do you do that when you have no idea whether some of these tariffs are going to stick, or for that matter, the significant, as you mentioned, percentages of your budget that are dependent on federal funding? How do you think that through right now, and help our listeners understand what your day-to-day is trying to manage
So we
this?
put together a budget. We passed it on June 6th, June 7th. And it was based upon the information we had at the time. And much of that assumed what we were in 25, we'd see again in 26. Subsequent to that, you've had Trump's budget pass. There'll be some hits to Medicaid. There'll be some hits to SNAP benefit. But a lot of the worst of it happens after the midterm elections for just, rank cynicism. So what I've done in the state of Connecticut is set aside what we call a rainy day fund. We got about $4 billion in there. It was originally oriented towards in case there's a recession, so I don't have to raise taxes or cut education spending. But there's a chance we're going to have to take some of that just to protect the most vulnerable as we navigate through the Trump cuts over the next year or so.
We've talked a lot about the negatives that are coming from DC, but I'm curious on the things that you see are opportunities. We talk a lot about in this podcast the positive alternative vision that we could be having in DC and in states. In particular, childcare, I know, is one area that you've very much focused on. I think everybody who has a family, especially those with young kids, are feeling the pain of the weekly bills that are coming in for childcare. So I'd love to hear about the work that you're doing in Connecticut on that area.
Paid family and medical leave, and then early childhood education are things that the state of Connecticut, many states, have been thinking about going back a generation or so. As you pointed out, I have a business background, so it gives me a bit of an advantage in trying to sell these ideas to, some communities that may say, "Oh my God, it's government overreach." When it comes to the child care endowment, we're going to have free early childhood education for all families earning up to $100,000 a year. It's going to take us a few years to phase into that. What that meant to young families is going to save them about, $8,000 to $10,000 a year, because that's the cost of child care. If you think life is too damn expensive, this is making a difference for those folks. For the business community that says I'm a little short of workers, really good early childhood allows mom and dad to get back to work, and means our workforce is robust and mom and dad can rest easy knowing their kid is being taken care of. And Dan, this is just, to me, every single kindergarten teacher I talk to says, I can tell that kid that comes from a really good pre-K program. They've been read to every day for an hour. It makes an enormous difference, gives those kids a head start. So it's the type of program I think makes a big difference for our state. And meanwhile, Donald Trump is cutting Head Start. Go figure.
Can you tell more about what Head Start is for listeners who may not know?
Our early childhood education is going to be starting for infant and toddlers right through to pre-K. And that means, once you've had your 12 weeks of paid family leave, you have the opportunity to get your kid into a really good quality program, half-time or full-time. And we'll set that up. You can go to your portal. We'll find out a place that's local. Some of them are co-located with perhaps where you're working, so it makes it easier for mom and dad to get there. Pre-K is often at some of our schools that maybe have an extra classroom or two. So we're going to get that rolled out and probably make it as seamless and easy for parents as we can.
Also, as part of your childcare plan, if I understand it correctly, there's some provisions people who are making over $100,000 as well. I'm curious on your thoughts on that because I feel like, and as when I was chief of staff in the city of Boston, we struggle with this too because obviously you want to take care of those who are most vulnerable. Those who are very well off, for the most part, they can handle and afford some of these. But there are people who may make a little bit over 100,000, right? Who still have significant childcare costs or costs on housing, down payment on homes, affording transportation, things like that. So, how are you addressing that middle gap, so to speak, of those people who may not be eligible for complete compensation, but still are struggling to get by?
That's the key question. I mean, Democrats spend an awful lot of time talking about how we're going to help the poor and the most vulnerable. You better be fighting every day for the middle class, or you're getting squeezed like there's no tomorrow. So, yeah, our child care is free of charge for folks earning up to $100,000, and then no more than 7% of your income over and above that. So it could be, $10,000 maximum or something for somebody earning 150,000 or so. That's still a significant savings from what they would have been paying before, trying to make sure we take care of everybody.
This points to a larger conversation in the Democratic Party, which is the future of our messaging. There are a lot of criticism, both now and in November of 2024 and beyond, about what our message is and where it should go. And there seems to be at least a consensus of the people that I'm having conversations about that it goes back to kitchen table issues, the economy and affordability, as you talked about. What is your thought on that? And then also other programs that you may be doing in Connecticut, similar to childcare, that are addressing those issues.
I just think life is too damn expensive, especially for the middle class, and people are not earning enough to be able to keep up. So I think I explained what we're doing on daycare. We cut taxes. Donald Trump cut taxes. He cut taxes for billionaires. We eliminated the income tax for working families, and we cut all middle class taxes, income taxes by 10%, just giving you an extra few $100s in your pocket, something you can count upon. What we're trying to do in terms of job training, free of charge, no questions asked, guaranteed job at the end of the day. You deserve a raise, and we'll give you the job training to make sure you get that raise. I don't want to help people just get by. I want to help people get rich if they have to get up and go to do it. I come out of small business. I mean, everybody's always trying to recruit big businesses. We've had more new business startups in the state in the last few years than we have in the last 13 years. These are small businesses on Main Street in New Haven, Whaley Avenue. Everything from a nail salon to a carpenter, giving you a start and a head start in life.
And do you believe that there is a binary choice between taxes and these programs that you're saying? I feel like there is a narrative, candidly, a hater narrative out there that you can't have all these programs because it's going to cause more spending and you can't have more spending. How have you managed that, cutting taxes while also creating programs like the child care benefit?
Get the economy growing. We've been benefiting from a strong national economy, but even then, Connecticut was not keeping up for the previous 20 years. Now we're exceeding our region. That means we have very low unemployment. That expanding economic pie allows me to cut taxes at the same time as do universal early childhood. I mean, I'm really a big believer in economic growth, and I think the Democrats got to get on that.
As a small business entrepreneur and who has seen businesses operate well and poorly, I'm interested in how you think about the future of the party, and the conversation therein. There is this kind of small, not necessarily the larger point debate, but there is a debate around, is it a conversation about affordability, people can't get by? Or I talked to Senator Ruben Gallego recently who said we should talk about people being able to prosper and get rich, right? We shouldn't just say you can't afford things, I'm going to help you afford things, but you should thrive and prosper. And we shouldn't have this narrative that people who live the American dream and get rich are bad people, that this should be an aspiration that everyone should have. What are your thoughts on that?
Look, I've never been so proud to be a Democrat. We can spend a lot of our time gnashing our teeth. I think people know where we stand when it comes to fighting for the middle class and making life more affordable. And look at the contrast to Donald Trump's budget. Now, I think the Republicans, there's not one Republican who was in the House or Senate 20 years ago would have supported this budget. There's not one Republican who can look in the mirror after signing on this Trump budget and say, I'm a fiscal conservative. I mean, these guys are good. It's tough to be a friend of the United States. It's easier to be an enemy of the United States when it comes to foreign policy. So I worry more about where the Republican Party is and what the heck happened to them. I don't recognize them from where they were 10 or 20 years ago. I think the Democrats are going to be just fine. We're focusing on the middle class, focusing on opportunity for your kid, making sure that's the North Star, and reducing costs for you. Everything from education to healthcare, that's going to be our focus. Trump is pushing people off of healthcare. We want everybody to have health insurance.
So I'm biased in my next question because I was a former Andover selectman in Massachusetts. I know you were a selectman as well. What advice do you have as someone who has built your career both in the private sector and in local government and now have to govern a $55 billion budget to DC right now with all of the discord on both sides of the aisle? You know, you see Democratic approval rating at 28% right now. And so it's not just Republicans that I think a lot of the country are disaffected with. What's your advice to DC and the discord that you're seeing?
I think there are too many lifetime, full-time politicians down there. I bring my own perspective. I started out starting up a weekly newspaper, then started out a telecommunications business. And when I go to the NGA, which is the National Governors Association, we don't just separate red and blue and have our beer. I end up talking to other guys who come out of small business. And then you look over, all the former attorney generals are over in another place, or the former congressmen are over there. So it's the frame of reference you bring in. I obviously like folks who come out of small business. They seem to have a can-do attitude. How do you get things done? And it gives me an opportunity to occasionally find some common ground with somebody wearing, the Republican toga.
And in this conversation, in the debate about funding Big Beautiful Bill, we talked a lot about some of the big buckets, Medicaid, SNAP, tariffs. Are there some areas that maybe people aren't talking about as much that you're concerned about where you rely on the federal government that could be at stake right now that you want people to be aware of?
Obviously, Medicaid is the big one. That's the big daddy. And they're not going after waste, fraud, and abuse. They're going after you. Other things that I worry about, let's say Planned Parenthood. I worry about what they're doing to our universities. We have the best universities in the country right here in Connecticut. We have the best and the brightest from all over the country, all over the world want to come to Connecticut. I want to keep more of them to stay in the state as well. So I really worry about the short-sighted attitude attacking our universities, attacking the education system, getting rid of after-school programs, cutting back on Head Start. These are very short-sighted ways to pretend to balance the budget. And you're not balancing the budget. It's getting trillions of dollars worse than it was a year ago when it was out of whack then.
I have one last question to you about disaffected voters, but first I have two other very important things to cover with you first. On the theme of mediation and bringing people together, you manage a divided state between Red Sox Nation and Yankee fans. How do you do that? And where do you think the border is between Red Sox Nation and Yankee fan? I don't know what it's called. I'm a Red Sox fan, so I don't know what Yankee fan call themselves, but I'm curious in your perspective.
We call ourselves our Red Sox bashers. Just be clear in life. People just want to know where you stand. You're right. We're divided. I'm a Yankees guy. Grew up in the southern part of the state. That's where I am. Everybody knows it. And I can tease the Red Sox guys like a little easier this year than the years past, by the way, Dan. Just be clear. Let people know where you stand. It works okay.
Yeah. And best pizza place in Connecticut.
We're having more fun at New York's expense, calling ourselves the pizza capital of America. We're getting their attention.
Did you get a license plate or something like that?
We have a license plate on it. And New York gets so darn mad at us.
That's some next level trolling, Governor. I like that.
And we have thousands of folks from New York coming to visit Sally's Pizza right in downtown New Haven. So it's working. I'm like P.T. Barnum. Just spell my name right.
Well, that leads to the last question. Thank you for your time. We appreciate it. As I mentioned, there's a lot of disaffected voters out there, people who voted for Vice President Harris in 2024 who are dismayed by the outcome, people who voted for Donald Trump who see what's going on right now and are feeling like it wasn't what they bargained for. or even people who support the president still, who just feel politics is cynical. They see people on both sides of the aisle doing things they disagree with. What is your advice for our listeners who know neighbors like that, who candidly will probably trust that listener much more than what you or me are saying? What message would you give to our listeners to bring to those neighbors to help get them re-engaged?
Don't say, oh, it doesn't make a difference. I quit. I'm not going to get involved. Believe me, elections make a difference. This last election makes an enormous difference. It's going to make an enormous difference in your kids' future, enormous difference in terms of our economy and opportunity. These things make a difference. Pay attention and get involved. I think too many people sat on the sidelines last time, and that was a mistake. We'll never let that happen again.
Governor Ned Lamont, thank you for coming on the People's Cabinet.
Nice to see you, Dan.
We hope you enjoyed this episode of the People's Cabinet. If you did, please like, subscribe, ring that bell, and put in the comments below who else you'd like to see sworn in. And stay tuned for new episodes every Tuesday. Let's go.